And they came up with 3 general questions that people could ask. Now, I'm not saying only ask 3 questions, but if you're really stuck and you just feel like, I can't remember the questions that I wanted to ask, I don't have them written down, or this is new information, these are the 3 questions. And I think that this could be helpful to people. Like, what are my options, including the wait and see option? What are the possible benefits and harms of each option? How likely are each of these benefits and harms to happen to me, including what would happen to me if I do nothing? And with these 3 questions could address pretty much all of getting to the heart of the matter. What does it mean? What are the risks and harms? And how does it apply to me?
But yeah, I'm glad you're here. Glad to be talking to you. I know, like I said, when we talked originally on our first conversation, that we sort of dove into some things, and I think of what we're going to talk about today is really, it's important for people to know sort of this information, or maybe know the information they should at least try to learn or find out, because I think that's a big problem in the healthcare system. So anybody who's listened to this podcast for a while knows that. I don't know. Like I said, broken is a really heavy way to say it, but I think there's some attention that needs to be placed in certain areas on our healthcare. So if you can introduce yourself, tell us who you are, what you do, preface the conversation, and then we'll dive in from there.
Well, hi. Thank you, Cody. It's really a pleasure to be here and address your audience. I've had a very long career in healthcare administration. In fact, really from a very early age, because my father was in a related field and introduced me to healthcare, that I thought this would be a good track for me. So I went immediately from college to get a master's in healthcare administration from the University of Michigan. And then came back to New York to start my career. And I worked in many kinds of healthcare settings, hospitals, a hospital association, 3 large accounting consulting firms in their healthcare practice. And my last executive role was at a managed care company, which I had really the honor of helping to launch and then to lead towards the end of my tenure. I come to this subject because my career ended suddenly by a health crisis, and I needed a stem cell transplant. And during my recovery, I really thought very hard about what I went through and how I was able to endure some of the things that I went through because I had the background in healthcare administration. But what I really realized was that I really didn't know enough about what it means to be a patient, and certainly with a patient with a chronic disease and a complicated treatment solution. So I spent a lot of time thinking and researching and talking to a lot of people about the subject. And so now I focus my work on helping people communicate better with doctors, helping people be more engaged in their care. There's really a lot of information and strategies and skill sets that no one ever teaches you, while you're growing up. I mean, if you had parents who were very adept at communicating with doctors, maybe you observe that, but it's not something they teach in high school or college, or even your physicians really don't share this information. So I thought, well, this is the contribution that I can be making now, the value that I could provide to people based on this sort of dual experience of being both a healthcare administrator and a patient.
Yeah. So, man, I just to make sure I'm clear and to emphasize this, you came to this realization that you didn't really know when you were already sort of in that space. So you had already been in the healthcare space. So just imagine, the person who's outside of that space and they're in that situation. Like what do they, it's like I said earlier, we're sort of almost at the mercy of the guidance of the healthcare system. And I'm not saying, it's easy to look at things now and the last, 4 or 5 years through COVID and all this kind of stuff. It's easy, I think, for a lot of people to look at the healthcare system and think that there's some sort of, some sort of pernicious almost intent there. But I think at the very least, there's the ignorance of what we don't know to even find out that we don't know, to know more about. But you came to this realization when you were already in that space. So just like the average person, they don't know about this. They're not in that space. So I don't know, man. How do you think it would have been different for you had you not been in that space? Had you just been an average person? This episode is brought to you by Excel Coaching Academy. Hey guys, I'm really excited to let you know that I started a mindset coaching business. So what I want to do with this business is I want to help entrepreneurs, business owners, salespeople, leaders, and fitness enthusiasts or athletes develop the right mindset to increase revenue, improve business or performance, and overcome the challenges needed to become the best version of themselves. You can get more information about this by emailing info@excelcoaching.academy.
Well, you hit on such an important point. Absolutely. I didn't know what I needed to know as a patient because I was on the structural, the operational side, not on the clinical side, but even doctors in helping their families deal with medical problems, they also are very frustrated by how the whole communication system works with other doctors in terms of being a patient or representing a patient. So no one's alone. And at first I thought, okay, well, just because I had a chronic disease, all right, people might not be able to relate because the average person may not have a chronic disease.
Mm-hmm.
However, we are all patients at different times in our lives, whether we go to the doctor once a year or once a month. Our health is very important. And as much as you need to have these other life skills, changing a tire, playing chess, doing karate, all those other like hobbies or things, or even like your work, if you have whatever work that you do, you put so much energy and effort into the detail of that.
Mm-hmm.
But until you get sick, you don't realize all the things you should have done even before you got sick,
Right.
or while you're sick, and what you need to do like immediately, or who you need to reach out to, or where your access points are for healthcare.
Mm-hmm.
So the biggest thing is that I was in the system, as I said, from a very early age. I had a doctor and a father in the health insurance industry who really knew a lot about healthcare. I was in that, and then I was in the field as a working person, and did so many things wrong as a patient. And the first thing, so, you leave your, family's guardianship and protection when you're in college and then afterwards. And when you come out, you're an adult, you have to take care of yourself. Well, in my 20s and 30s, and even till my mid 40s, when I was diagnosed with this genetic blood cancer disorder in my mid 40s, I was diagnosed with this disease. I never knew that I had it because I had very few symptoms. So what I did wrong, I did so many things wrong. I did not have a primary care physician. This is absolutely imperative that you find a primary care physician who you know, who you trust, who you can have a continuing relationship with, who knows your story, so who knows and trusts you when you come in as a patient and you say, I'm just not feeling right. This is what's been happening, that the doctor knows who you are and knows that, okay, well, I know this person's story, and let me investigate and let us go through this diagnostic process together. So having a primary care physician, very important.
Mm-hmm.
Second thing I did wrong is I ignored symptoms that I had. I did have symptoms, except I'm like a tough cookie. Things don't really bother me that much. And I was in my 20s and 30s, and maybe like the average highly productive working person, they let things go by. You have a full-time career, you have children, all right, I'm feeling a little itchy. I feel a little itchy after I take my showers. Okay, I put on my clothes, I feel better. Well, that ended up being a symptom of my disease where you have sort of antihistamines that react to water and then drying off. And that's a condition of this blood disorder.
Mm-hmm.
And I did not investigate. So I had symptoms and I did not investigate those symptoms for 20 years. So I was in the healthcare system. I cared about healthcare. I had a career in healthcare because I thought healthcare, and I still do, is so important to support people having quality lives and productive lives and achieving their dreams and their goals. And I still feel that way. And that's why I'm still doing the work that I'm doing. But now I feel like I can offer something more to people, to giving people a pathway to be able to take care of their health in a way that gives them really the structure and the courage to do this, because it's not easy being a patient, but it's not easy saying, I need to see so many people that I know don't have an annual checkup. And unless your work requires it, your school requires this, when you're young, there's nothing wrong with you. You don't get a checkup. So you're not having that experience until something goes wrong. So it turns out that like 50% of the workforce have one or more chronic diseases. What does that mean? So, whether it's diabetes or gastrointestinal or some type of orthopedic disease or high blood pressure, whatever it is, regular people who are mainly healthy have these chronic diseases, which could get so much worse if they're not taken care of early on, because there's a lot of medical advancements and medicine and other interventions that could help people forestall certain diseases from getting much worse.
So, okay, so there's a lot there that I want to touch on. I think the first thing would be, you mentioned in the beginning part of that about I can't remember exactly how you phrased it, but it was about the education, about knowing these things. So, there's several things that you can say that relate to this. I think one is accounting. Like, we're not taught basic accounting in basic education. Why do you think we're not taught basic, like just very basic health in our public education that we go through? I mean, because it seems like that would be something that's like foundational,
Absolutely. I don't really know. I never investigated like sort of school health or courses in health. I mean, I think there's a focus on sexual health or general health issues in school. My kids are in their 30s now. I don't quite recall what their health education consisted of, but I know it was mainly sexual health related. But yeah, I agree with you. I think this is like a fundamental thing, because it's important for people to know that it's okay. Look, everybody is fear. No one wants to be sick.
Right.
So when no one wants to be sick, you're afraid of it. So when you're afraid of something, you put it off. You don't do what you're supposed to do. You don't take care of it, right? So it's about, teaching young people, it's in a normal course of life. Now, look, ultimately, in sort of a ideal situation, I would love it if, pediatricians or primary care doctors would have sort of resources for people to say, hey, I'm just going to give you like this pamphlet, or we're going to go over some things. It's a first visit. This is how I think that our communication should go for every visit. And I think it'll make you feel better, and it'll give me the information that I need as a doctor, and that together we could work on your health prevention, health monitoring, all the things that you need to know. And yeah, you're going to be afraid or frustrated or confused sometimes, but I'm here to help you. Doctors don't do that.
Well, and I'll get to that in a second, but I think, there's just so much that the average person is not taught about basic health. Like, and this is not, what would you call it? This is not something that's not grounded in science, what I'm about to say. These are real things in science that help us health-wise that people just don't know about. Things like sunlight, things like grounding to the earth, walking with your bare feet on the ground, things like proper sleep, enough sleep, quality sleep, things like, what's in your diet and when you eat and how you eat. I mean, these are just very basic things that if we knew the information of and that we used, we could really, really change our lives. I've heard people say, and I'm not in this space, so I don't know if this is true or not, but I've heard people say that most diseases survive in an oxygen deprived environment. So that means that breathing properly, breath work could really help our health. And that's not just mental health. That's like a physical, biological response to these things. You mentioned doctors, and I think this is the fundamental problem I have with the healthcare system. Most doctors in the tradition, I guess the mainstream healthcare system, they prescribe a medication to treat a symptom of a thing. But a lot of times they don't get to the root problem of the thing. It's like if you have an issue with your car and your car, you hit the gas pedal and it's not moving the way it's supposed to. You don't go and put stronger gas in the car. You find out what's going on to treat the actual problem. And I don't know why we don't do that, with our bodies. Like why is it we're just trying to, this is a kind of a funny analogy, but have you ever seen the game in an arcade? Like I think it's called whack-a-mole or whatever. You hit one, another one pops up. It's like you're doing that with symptoms in the healthcare industry. Like, why do you not go to the actual problem of what's causing the problem? I don't know. I feel like, and I'm not saying medication is not useful. I think it is, but I think there's probably a very small percentage where medication is the actual answer.
Well, I think it's very personalized because everybody is different. And in the wake up call for me was that I was asking my doctor, like, where does my disease status stand on like average patients? And he said, well, if you met one patient with myelofibrosis, which is my diagnosis, you've met one patient. And it was a little scary to me. I mean, partly was comforting. Okay, all right, I'm unique and it's going to work with me. But the other part is pretty scary because if everybody is so unique, it takes so much. Could you imagine how much work it takes to get to know that person and what's affecting that person? But my point being, the person needs to really know themselves and participate in this process. And like you're saying, a doctor isn't going to prescribe, okay, some may say get 8 hours sleep, wake up in the morning, go outside and do grounding, make sure you're drinking, water. I mean, that's sort of on a checkoff list, but a lot of people can't do that. I know I've struggled and I really focus on it because I know how important drinking water is, breathing, so important, all these things. But you have, as a person, as the patient, have to come to the table with either understanding the resources, doing the research, talking to peers, friends. The internet is a treasure trove of information, going to trusted sources and learning as much as you can. So when you have these appointments with the doctor, you say, I've been doing these things because I know this is happening for me. What else could I be doing? What other resources? Or how does medicine complement what it is that I'm doing? So it's really about the person having more knowledge, like you said, understanding how much these other really aspects of taking care of yourself impact your health. And that's really important. And I do think that patients have to be more proactive in asking the doctor questions, in doing research, and trying to put as much together as they can to share it with the doctor and come up with their own questions. And also, ask, because like you said, people just really off the top of their head, if they go into an appointment and haven't really thought about what they want to accomplish at each appointment, then they're really not going to have the questions at their fingertips to be able to ask a doctor. And the way that a doctor responds to a patient is that if the patient doesn't ask or ask for explanation, the doctor assumes that the patient understands. And when I figured that out, I started preparing a lot more for appointments, because while I would do research or follow up from other appointments, and the doctor would see that I've been tracking what the doctor has been telling me. I've been looking at other research. I've been also, every specialist that I go to, I ask the same questions to, because it's the same me, it's the same body. They're just looking at it from either my eyes or my throat or my thyroid or my heart, or they're looking at it from different perspectives. But I'm the one who has to put it all together. And that's why I came to the conclusion that the patient needs to have this, as I said, this pathway to be able to put it all together, to be able to communicate better with doctors and take care of their health. And that's why I came up with like a very specific framework that people can use, because it is so overwhelming. It's an overwhelming process.
Well, I think another thing too is I think a lot of people just feel like, you know, they just feel like a number at the doctor's
Mhm.
office. Like the doctor comes in and they're there for 5 or 10 minutes at the most, and it's just a check, check, check type thing, and
Yeah.
they're just off to the next one. I think people they don't feel like that. They don't feel a connection or a relationship with that person who they're really relying on to
Mm.
inform them about their health. And when you think about that, if you think about like this person, you're trusting that this person is going to give you guidance or recommendations or whatever about your health, and you can't trust that. You don't have a relationship with that. That's really like it's kind of depressing almost, because I imagine that some people go into the doctor's office and they know there's an issue, they know something's going on, and the doctor just tells them, here's a prescription for pain medication or whatever it is, and then sends them. Like, that's not helpful. That's not helpful, and we don't. But I mean, it's almost like the system is designed that way, because if a doctor were to take an hour with each patient and they saw 8 patients a day or whatever it was, their office probably wouldn't survive. They can't survive. I don't
Right,
imagine they would survive on that. So they
right.
have to fit it in, where there's 5, 6, 7, 10 people in an hour. you know and so I think, I'm not saying it's designed that way, but I think whatever it has come to, that is how it operates. It's just not. It's not a thing where you can go in and, like you see, you're asking these questions. I mean, what can you really get? Like 3 questions, maybe you have time for 3 questions, and like, yeah, I don't know.
Well, I would hope that a doctor doesn't only spend 5 to 10 minutes with you. That would be
We would
just
hope. Yeah.
heartbreaking, heartbreaking. Okay, so if you find that you have a regular doctor that you see and you're not just going in like for sick visit. So, doctors have like regular visits and they have these sick visits,
Hmm.
and they seem to be having less and less sick visits because they seem to want people to go to urgent care, which is a whole other story. But you want a relationship with a primary care doctor, internist, or if you're an older person, a geriatric doctor, like for children, it's pediatric. Those are the doctors you want to find the best one for you and you want to have a long-term relationship with. And it's really important. And either you find that doctor through referrals or you have to go through a few to find the one that's going to really work for you.
Hmm.
And, my recommendation is to try to find one as early as possible, not wait till your 40s and 50s to find somebody in your 20s and 30s that you can stay with, that you really trust. Because really, by the time like that you're 40, you will know whether you have certain things happening to you or not that you're going to need extra interventions. But you want someone who knows you and who cares about you. And I think you won't know that just from doing this detailed assessment of all the information that's available to assess, who this doctor is, where they went to medical school, what degrees do they have, what board certifications do they have, how do they run their practice, whether it's in a group, and who their backups are, and what hospitals are they affiliated with. You go through all of that, and so you're sort of narrowing it down, but you really have to meet them. And when you meet them, you have to come prepared to use your voice and tell them who you are and tell them, I am ready and willing to participate in my care. You sit there with a notebook on your lap, and they know that you're prepared and you're ready to be engaged in this discussion about who you are. So, I hear you. I hear about it a lot. In some parts of the country, it's very difficult to find a primary care physician. And in fact, what I hear from younger people in their 20s and 30s, and they said, yeah, it took me like 3 months to get an appointment with the
Yep.
primary care physician that I wanted. And who shows up but a nurse practitioner? I didn't even get to meet the doctor. And that's really disconcerting. But there is a shortage of primary care doctors in the country. And the reason there's a shortage is that it's not the most lucrative specialty in medicine, number one. Number two, it requires a lot of patient, direct patient contact and communication. It's not just, oh, interesting body part or interesting neurological. This is the people who are in the primary care, internal medicine kind of field are such dedicated to helping people have better health and better lives. And so there aren't as many of them because it's really hard. And maybe the healthcare system overall doesn't support how hard this work is. Because, like you said, physicians wouldn't be in practice if they could only see even one patient every half an hour. So I
Right.
found it's like 15, 20 minutes versus 5 or 10 minutes. But it's very hard for different regions around the country. There's a real shortage of primary care doctors.
Yeah, well, maybe that's just been my personal experience about the very quick, 5-10 minute deal or whatever. But I've also, I mean, I've been fortunate enough to only go to the doctor for very minor, things or whatever. Um, so I don't know, maybe it's relative to the reason that the person's there. But so it's really hard to have a conversation about like the questions to ask about your health and healthcare without getting into the financials of it. So because I think a lot of people their biggest sort of concern is how to pay for healthcare. And I don't know if you work with people like how to like, the questions to ask like on the insurance end, but do you work at all or do you recommend like a health savings account, an
Oh,
HSA for
yeah.
people?
So that's not my area of
Okay, okay,
expertise. Yeah.
okay. Because I was going to say because I heard a person a couple days ago on another podcast. They were talking about the HSA, and I don't think a lot of people understand like really how that works. And so if that was your space, I was going to get into it with you. But
No, the only thing I would say is that if you have an employer that's providing an HSA, provide you health insurance, provide you employee assistance programs and wellness programs, it really is to your advantage to use all of those programs to the max, to the benefit of you and your health. And most people don't. But the employer's making this big investment and then they sort of step back and
mhm.
they leave it up to employees to be sort of more transactional. We'll just use it when you need it. Well, that really doesn't like line up with how you need to focus on preventive health or know where to go in an emergency or not wait for an emergency or how to get access to healthcare. So from that perspective, I am a really big advocate for employees have all these benefits available to them to use those resources, whether it's located in human resources or there's a people department or they really HR departments are called all different things these days. So whoever it is that you can go to find ask those questions to help you decide, okay, should I set up an HSA? Okay, or should I rely on my health insurer? Perhaps they could direct me to the right provider. A lot of health insurers have specialty, they call it programs of excellence. So if you have cancer or diabetes or some chronic condition, the health insurer has additional resources for you to use that could be helpful. And I know when I was going through my time, I used the resources of my health insurer as well to complement all the services I was getting from the hospital, from my doctor, and all around. So there's so many, if you're employed, you have access to so many resources. It's about finding them out, really understanding it, being an expert. I mean, it's part of your package that you are getting being employed.
Yeah, man, I really have to get somebody on here to go through all that with me because I think that's really valuable for people to understand that to understand. And I don't know any like I'm nowhere near educated in that space to even comment on that. But I think if I could find a person who's maybe in that space to sort of explain that, kind of like how you just did, and go into a little bit more detail because I think that is important, and I think a lot of people don't understand. A lot of people they just look at their whatever their health care is from their employer for that week. It's X dollars per week, and they just see it that way. But there's a lot more that goes into it, like the HSA. Even a lot of people don't even understand what that is. And my understanding, and I don't know if this is accurate or not. My understanding is I don't know about an employee, but I think it is as an employer or business owner, if you have an HSA, I think that's tax deductible.
Yeah, so I can't respond to that. But yeah,
Yeah.
I mean, if this is an area of interest, I'm sure there are a lot of resources and people who can speak to that.
Here, let me because I don't want to give any misinformation. Let me do something real quick. Hang on just a second. I can screen share this with you really quick. Our HSAs tax deductible. I use Perplexity, which is sort of similar to Chat GPT, and we're going to see really quick because this is an important question. But yeah, I think you're right. I think that's a whole untapped resource for a lot of employees and employers. So I wanted to here. Let's see what this says first. I'm going to screen share with you really quick. I can screen share this with you, and we can kind of look at it. So Perplexity is good. I don't know if you use AI at all.
Oh
But
yes, I love Perplexity. Yeah,
okay, yeah,
I think
yeah.
it's
Chat
great.
GPT is a popular one, but all right. So this says, and it's got a couple sources here. So it says yes, HSA health savings accounts contributions are tax deductible. Key points regarding HSA tax deductibility. And it's got some information here, but yeah, essentially for 2025, the HSA contribution limits are $4,300 for individuals and $8,550 for families. Individuals age 55 and older can make an additional $1,000 catch-up contribution, and this is sourced from People Keep Incorporated, H&R Block, and what does that say? Thomson Reuters Tax. But anyway, yeah. So I think the HSAs are something that's really misunderstood, but or not understood. I was going to ask you something before we got into that. Oh, you mentioned earlier you had a system, like a system kind of in place, and so I would imagine for each person it's probably different. But is there like a set generic? I don't want to use the word generic, but for lack of a better word, generic questions people should be asking, or should they be? What do you mean when you say system?
Okay, so the framework that I created is really to create a way for people to approach their communication with doctors, which when I say communication with doctors, it's really the metaphor for taking care of your health. I mean, it's part of it, clearly. But so what I wanted to set up, what are the fundamental things that people need to do to communicate better with doctors? So I set up this framework because I felt like I didn't learn this anywhere. I had to sort of figure it out by myself. And then also I did a lot of research to figure out, well, what did health researchers find to have people be really engaged in their care? What are the things that people need to do on their own to then work with doctors? So I came up with this framework. So I'll talk about the framework, and I'll stop at each part, and you could ask questions or input however you want to do it, because
Okay.
one part of the framework, and the part that you raised, which is so important, is asking questions, and that is its own part of the framework. It's that important. So I'm so glad that you raised this. But the first part is really preparation. So if you're going to see a doctor, whether it's once a year, an annual visit, or you have a particular issue, you've seen the person on an ongoing basis, you really should prepare in advance. And by what that means is that you should really take some time, and not the day of the visit, in the weeks before the visit or a few days before the visit, and take a notebook. It doesn't mean however the notebook is, but I say a notebook because you're going to start a system where you're going to track, so you don't have to remember everything. You can use your energy to communicate, and you don't have to remember things. You could put it down. So part of the planning in advance is understanding what you want to accomplish at this visit, what your priorities are, what you want to make sure you're covering with the doctor, your questions, any research that you have done on the particular subject, what something's bothering you or something you've read, or what do you think about this, whatever it is, put it in the notebook, because you want to have your agenda. It's just in a way like a meeting. I mean, I have this perspective because I was a healthcare executive for all these years, but anybody who runs a business understands the importance of having really, an agenda and goals set out, and really what you want to accomplish. And that's really what the preparation phase is all about. When you put your thoughts in writing, then you have limited appointment time. So you want to be able to have this being a really efficient and productive meeting. We already talked about that pressure of limited appointment times. It's not just for the patient, it's for the doctor. Both parties feeling this pressure of limited. You come prepared, the doctor sees you're prepared, the doctor relaxes a bit and is able to like respond and interact, and both parties feel really good about this. And also by planning in advance, you're able to really free your mind. So you're able to react to what the doctor is telling you. You don't have to like come up with it because you've already like thought about all the things you want to ask. So the doctor is then responding to you. You have a freer mind to be able to say, could you explain that again? I didn't understand what you said. Or can we talk about that a little more? I want to understand it more. And so it basically is a way to start the appointment with this intention, being very intentional about what you want to accomplish. And I just want to say a few words about the importance of writing things down. And I know we're in a digital world today and a lot of people use their phone, and I guess it's okay. And I can, as we go through this, I can tell you why writing it down is probably more useful than putting it into your phone or digitally. Certainly, I've not really seen anybody with a laptop on their lap, maybe an iPad and maybe their phone, but it's not really the same because when you write things down, like you remember them better. So you think I'm writing it down so I don't have to I could always refer to it. You write it down, you will have better recall. It's proven. Science has proven. You write things down, the hand to paper, you write things down. You're giving more you're really, in a way, you're planning your communication, a very concise communication. And it sort of also makes you relax a bit because it's really a very upsetting situation to be in a doctor's office. And I have to tell you, from the time I got sick till still now, 6 years later, 7 years later, I still hate going to see doctors. I'm in the healthcare field. I'm used
Right.
to it. I've been having a good recovery. I'm working on this stuff. I do not like sitting in the exam room. I mean, talking to the doctor is okay, but I don't like going to doctors. I don't like sitting in an exam room. And I make the best of the process by using this process. But I always have a notebook in my lap. So whatever the doctor told me in the meeting before, I can refer to it. Oh, you said I might need another bone marrow biopsy. You said it would be 3 months. Well, it's 3 months later. But what it is, I'm taking charge of my own health. I'm being the CEO of my own health. And that's one thing that I really want to impart to your audience. You need to be the CEO of your own health because it is so complicated and everybody is so unique, and you need to have your voice and you need to be able to express yourself in a clear, concise manner.
So, all right. So before we move on from preparation, I want to ask this because, so do you recommend a person go research their symptoms? Because, we've all probably been to Google before and put our symptoms in and then we figure out we're dying or whatever, so do you recommend that a person do any sort of research before they get there, or should they just get their information from the doctor?
Oh, no, I research all the way. I'm a big
Okay.
researcher. If something's bothering you, part of your thinking about what you want to discuss with the doctor is doing some research.
Okay.
But I will advise people not to make themselves crazy because
Right.
it's a thing. So don't make yourself crazy. And what you need to know, like in my case, I know when I research something because I don't have any medical background, clinical background. I would say 80% I'm wrong because I don't understand a lot of the things that I'm finding because it's very scary because there's so much out there. So, obviously, as specific as you could do your research, what it will give you is the questions and the language to be able to have that conversation with the doctor. Now, most doctors, and they've done there's like essays on this. Doctors, they call it Dr. Google. They don't like when people come in and say,
Yep.
well, Google said this, and oh, Dr. Google said that. What they want, what's best to interact with doctors is to come in with a thoughtful questions. Look, based on some of the things I've researched, this is my question. what else? And they'll probably say, okay, well, we need to go through the diagnostic process, and I
Okay.
need to talk to you, and I need to hear all your information.
Okay. Yeah, I appreciate you clarifying that, because I know that's a big thing for a lot of people, So yeah, I appreciate that.
Absolutely research,
Okay.
but the way you communicate it. And the more you do it and learn how, the hardest thing is not to panic,
Yeah,
because
for sure.
I've lived it. The hardest thing is not to panic.
Hmm.
But if you're really taking care of yourself, the questions you want to ask is, what else can I be doing? What
Hmm.
else should we be measuring? What else should we be monitoring? That kind of thing, or I have this family history. What else should I be looking for? And I'm not an expert in genetic testing, but I've learned a bit. I waited a long time to get a full panel of genetic testing, and I'm really sorry that I waited. It turns out that I'm at average risk for all the things that they could genetically test for, including breast cancer, which my mother and her sister died of breast cancer. So I am not, I'm not at higher risk. I'm an average risk for breast cancer, but I wish I got all those those tests done at an earlier stage. And I'm encouraging my sons in their 30s to get those genetic tests so you can be prepared. Ask for, like, what should I be doing to monitor this? Or you could research it on your own and then say to the doctor, okay, I understand this. What do you think? And what have you found with your other patients?
Okay.
Yeah.
All right.
So the next part of the framework is language. And I decided to make this a separate section, and a very important, because I found that people really shied away from wanting to learn the language of their disease, how to pronounce a diagnosis, what a diagnosis means, what their medications are, how to pronounce the names of medications. I mean, it's you, it's your body, it's you, it's your brain. You need to put the focus, you need to learn it, you need to be fluent in the language of who you are from a health perspective. And that's why I put language in, like, it's, and I'm just talking about like basic understanding, knowing your medical history and your, treatment, what treatments you've had, what medication. Um, not everybody can read health information at the same level of literacy, but you should read it to the extent that you're capable of and ask for help. And so I think that's important. You also need to know the language to make informed decisions for your own health. The doctor brings something to you, you have to want to, understand. And I know there's a lot of fear, and people say, it's not for me, I don't want to do it. But
Hmm.
you'd be surprised how many highly educated people like can't pronounce the names of their medications or their diagnosis. And I just find that just really just sloughing off a responsibility for your own health.
Hmm.
So,
Well,
yeah.
and not to interrupt, but like with the medical field, in the medical space, there's a lot of there's a lot of is it the prefix before the word, the suffix, those kind of things? Like you mentioned, geriatrics and pediatrics. There's a lot of that involved in that. So I think understanding language is pretty important. And it's and like with medications too. Like the last portion of the word means a lot of things. Like a different antibiotics and stuff, penicillin, amoxicillin, those kind of things. Like those are important.
Yeah, because when the doctor prescribes it, you have to say, okay, well, oh, how do you pronounce it again? Oh, what's is that the generic, or are you giving me, is it still the, regular
Hmm.
brand? Is it the brand? Is it a generic? Um, and what are the contraindications? So I saw the doctor and the resident, they were doing some, I guess, some search and checking about contraindications. And, they said, oh, no, okay, you can take this, you can't take that. Okay, fine. I went home and I said, I went on, Google and said, are there any medication checkers for contraindications? And It's publicly available. So they were doing it there. But you know what? I just got into that habit of saying, well, this is available for me to do a contraindication, so I can bring it to my doctor as well. You go to a dentist and they prescribe certain antibiotics or something before a procedure. You want to know whether it's contraindicated with any of the other medications that you're taking or any of their reactions or whatever. I mean, you can ask a pharmacist, you can, ask your doctor. So it's all part of like making sure you're educated, this whole part of language, but it's also about finding the language that expresses your voice. It's important for the doctors to hear exactly how you're feeling, what it is you're feeling, and you need to be able to express that. So maybe you first express it to a family member or a friend, say, I'm feeling that, this or that. And your friend says, oh, could you describe it a little more? And you have to like sort of work on figuring that out. I had this particular experience where before my diagnosis, I had this body aching pain that was really destabilizing, and I was getting it quite often and I didn't know what it was. I couldn't describe it. It was just like flu-like body aches. I don't know. I was self-medicating with Aleve to relieve the pain. Again, this was before my diagnosis. And then when I was doing my research a few years ago, I found this research that was done in the late 70s. It's called The Language of Pain. How these researchers up at McGill University in Canada came up with like 90 words to help describe pain. So I know you've probably been to a doctor's office where they have those smiley faces across the wall from happy to sad. And I just can't stand those faces because I think it means nothing. But to have access to words to help express your pain, yeah, is it a throbbing pain? Is a sticking pain? I never had the words to describe what my pain was. And, my research the last few years, boy, I wish I had those words. And so when I have workshops, programs, and I talk about it, I talk about, access to these resources, to have the words, have the language of what you're feeling. I mean, I don't know if you know anybody, young people seem to have a lot of migraines these days, and they keep pain journals. So when you get the migraine, and so when you go to your doctor, you're able to say, okay, well, this week, this is what I experienced with my migraines, because the doctor's always asking, what time of the day does it happen? What activity you were doing? What will it happen? How long it happened? What foods did you eat? All these things. So people in chronic pain are typically it's good for them to keep these kinds of journals. And
So
hopefully doctors will, you know, instruct them to do that.
yeah, just real quick, I hate to interrupt. I want to say this because I got to close in about half an hour, but I want to make sure you got enough time to get through this. But I do want to say this really quick. You were talking about the medications and what medications do. So I was through perplexity, I looked up examine.com. So examine.com is a website that you can go to and you can research supplements. You can research clinical trials and supplements and stuff like that. And I thought they might do medication, but it turns out they just do supplements. So I was
Well,
going to refer people to that, but
well,
there
if you
may
say,
be
put
there.
in medication checker,
Okay, I was going to say,
checker.
yeah, there may be a reliable website for medications, but examine.com is just supplements. So, but yeah, I'm sorry.
No, that's quite all right. Quite all right. Okay, so the third part is questions. The third part of the framework is questions. So, advanced planning what your questions are, but really being able to actively participate in the discussion with your doctor requires you to ask questions, because questions help you understand what's going on. It helps you clarify. It helps the doctor know what you don't know from what you do know. It helps you understand. I mean, the biggest thing for me for questions is like, what do I really understand and what I don't understand? And you do that through questions. So there've been a lot of, so questions drive discovery and meaning. And that's really important as a patient. You want to understand, what is the meaning of all this? What is really happening to me, and how I can help ameliorate what's going on and improve my health. So you may be familiar with the topic, the term question prompts.
Mm.
So this has been long studied in the healthcare industry, question prompts. They studied, well, if we gave patients questions in advance to ask the doctor, would that improve patient engagement and the conversation? And would it improve health outcomes? And it turns out that it does. So first they started with like 22 questions. There are 22 standard questions that any patient can ask with any diagnosis. And then they kept saying, okay, well, that works, but maybe we could reduce it to 15. Oh, and that works. Oh, well, maybe we could reduce it to 3. And they came up with 3 general questions that people could ask. Now, I'm not saying only ask 3 questions, but if you're really stuck and you just feel like, I can't remember the questions that I wanted to ask, I don't have them written down, or this is new information, these are the 3 questions. And I think that this could be helpful to people. Like, what are my options, including the wait and see option? What are the possible benefits and harms of each option? How likely are each of these benefits and harms to happen to me, including what would happen to me if I do nothing? And with these 3 questions could address pretty much all of, getting to the heart of the matter. What does it mean? What are the risks and harms? And how does it apply to me? What is this test about? What's this procedure about? And, what are the risks? Are there any safer options for people to know these things so they have the language and the words for these questions so they're not stuck every time? I mean, now these are like ingrained in my brain. But before I put together, my approach to this, which is based on my experience, but also my research, because it's been done, but it's so diffuse across the country. I mean, you could find it, but you get sick, is the first thing you want to do is do an extensive resource list or go to Barnes and Noble and buy a book? No, you're afraid, you're hurting, you're not feeling well. The time to learn is not when you're not feeling well. And I can tell you from experience, the time to learn is when you're not feeling well. The time to learn is when you feeling good about yourself, feeling healthy, feeling good. Okay, how can I maintain this? What are the things that I should be doing? What are the things that I should know? Also, questions reflect a curiosity, and the curiosity about your health is really important. If you're not curious about your health and yourself and what's going on, then how do you expect a doctor to be curious on your behalf? You have to participate wholly in this process. It's very important to do that.
Okay. So
So,
I'm
so
sorry.
the
Go ahead.
next, you have a question?
No, I was just gonna say. So you were saying questions is options, the benefits, harms, and then I guess the likelihood of those benefits, harms. Okay. Yeah. All right.
Yeah. Yes. And there's actually a website for that. It was developed by a organization in Australia. It's called the AskShareNo.org. Ask Share No.
Okay.
All right. So the 4th part is participation. So you're in the exam room with the doctor and you are taking the initiative to engage. And when you do that, it sets in motion a much improved experience and communication with the doctor. You're sharing your story. You're having the doctor get to know you. You're letting the doctor know you want to be involved in decision making and that you are able to navigate the healthcare delivery process and system, or you ask for help, or you have a friend or relative help you. And you need to really stay the course under stress. I mean, taking care of your health, isn't necessarily stressful on a routine basis if you're taking care of yourself. It's that mindset of I'm doing it for me and I'm doing it for my longevity. It's for me because I want to feel good to accomplish all the things that I want to accomplish in life, that I want to stay on this side of life and do all the things that I'm looking forward to and that I want to do in my life. And the doctors really get to know you through your participation. And when the doctors know you, they're able to ask you more questions so they can sort of figure out if it's a sort of a puzzling kind of issue where they need to go deeper, or they need more information or more testing, or they haven't thought about it, whatever it is, you want a doctor to know you. There are sensitive issues that people have a tendency to withhold from doctors, whether it's, how much you drink or smoke or do drugs or sexual activities or things you might really not want to share with the doctor. And yeah, you might not want to share it at a first uh, visit because you may just be getting to know the doctor, and it's understandable you might not want to. But if there's something wrong with you, it might be related to one of these things that the doctor needs to know about, including either taking supplements or doing other kinds of experimental or alternative things. I mean, you want the doctor to know so they can look at that in terms of what else they're seeing and try to put it all together. And certain situations are pretty complex, and the more doctors know about you, the better off they'll be able to treat you. So I really needed, given my reference to mindset, because I worked a lot on that during when I found out what was wrong with me, and also having to go through a stem cell transplant and it being very risky, and having two children who I wanted to be in their lives. And, you have to do a lot to work on your mindset. So I really thought that the last part of the framework is understanding the process of courage and having the courage to do things for yourself, for your own purpose, and to really create what's right for you and giving you the strength and the foundation for communicating better with doctors and taking care of yourself, and not hiding under a rug, and just keep going and really having the courage and knowing that when you do small things, look, whatever it is that you're trying to do or improve in your life, you probably have found that when you do small things, small actions to work on something, that they build and build and build until you have the strength to do more and keep going and take care of yourself. And so I thought that this was a very big part to add to this whole equation, because nobody talks about this either. They talk about it in other realms, and you can buy a lot of books on mindset and courage and whatnot. But apply to your own health and taking care of yourself, it does require a lot of courage. And just know that courage can coexist with fear, frustration, worry, anxiety, which is all connected to having things wrong with you from a health perspective. But knowing that all that worry and fear can coexist with having courage.
Yeah, I think that's a really good point. I think it's hard for a lot of people, a lot of us to sort of look at that area of our life, the health, because it is something that's it's so it's so real. It makes everything, like, it's easy for us to, I think, when we think about career or we think about like longevity, as far as our finance goes, it's easy to sort of push that out. But a lot of times health is like one of the most present things. Like, it's like right here, right now. And I think with a lot of things that sometimes we want to sort of you hear the phrase that ignorance is bliss. Sometimes maybe you don't want to know about the diagnosis, but maybe the earlier that you know, or the earlier that you get in there and sort of find out these things, maybe it'll be better off for you in the long run. But so, okay, so just to summarize, you said preparation, language, questions, and that includes options, benefits, and harms, and then the likelihood of the benefits, harms, and then participation and courage. Okay. Okay. Yeah, I think that's a pretty good starting, pretty good framework. And then you mentioned too, you said there was a prompt for the questions, like a
Question prompts are questions that you would give patients in advance of their visit.
okay.
So let me mention, I love the internet. I mean, I love access. I didn't have it until I got out of college, but I love it. I am right there. So you should be scouring the internet for the questions to be asking your doctors. And you can develop your own questions. And also, there are so many trusted sources of information. So if you think you might have diabetes or a heart condition or it ran in the family, go to one of the trusted sites of the associations, the American Heart Association. There are many, many associations. The American Diabetes Association. There was a foundation for my disease that only came into effect 2 years before I got diagnosed, myelofibrosis, under the category of myeloproliferative neoplasms. And I discovered that organization at the beginning of my disease, but they only were in business like for 2 years before. And I went online and I saw the description of the president and why he started this organization to further research, because there wasn't enough research or treatments for this disease. And I found his phone number and I called him up and he answered his phone. And I got to talk to this guy directly. And he told me about all the resources and services available on their website and through their peer organizations and the doctors who are part of their foundation. And it was just amazing for me. Such a great community. And most disease categories have these communities. And you can get as many question prompts as you need from the internet. And
Yeah.
who knows, maybe the next time I have a series of questions, I'm going to go to Perplexity. I'm
Yeah.
actually I use Perplexity help me with my LinkedIn posts.
Yeah.
So, but I
Well,
do.
so
Yeah,
I'm sorry, I didn't mean to cut you off.
no, that's okay.
I was just going to say Perplexity. I don't think a lot of people realize that it's more research. It's better for research. Like it's more research based. It has sources and things like that. Chat GPT is good, but I don't think it does what Perplexity does. I think if you're if you're looking for specifically trying to research something, I think Perplexity it works out well for that.
Yes.
So I wanted to ask you this, and I know health, like you mentioned, that sometimes there's uncomfortable things to talk about with the doctor, but do you find it beneficial or do you recommend for, say like a partner to talk to the doctor with you? And so like the reason for that might be, let's say that if a person like wakes up in their sleep, they're not aware of it, the partner might know that. And they might say, well, hey, you've been waking up in your sleep. You didn't used to do that, whatever it is. Do you recommend sort of having a partner there or a person that really knows you in that space? Or do you recommend that it be a private thing when you're with the doctor? Because I think people maybe have mixed opinions about that.
Yeah, so I think if you're comfortable with your partner or even a friend or whoever it is, because you're feeling like really nervous or you just want another set of ears because it's a complicated kind of conversation, I have this real life example of how it was so obvious. And I went with my husband. My husband was experiencing very low red blood cell count. And so he's in his 70s. He was experiencing low blood cell count. And the doctor was giving him like iron pills and doing all this other stuff and doing more testing, and nothing was happening. I said, you know what, let me go with you to the doctor,
Mm-hmm.
that doctor, and I'll have this conversation. So when I was there and he's really just, the doctor like had nothing really to like anything else to explore. And I said, well, do you think it has anything to do with the fact that he donates blood every month? And he goes, he does? He goes, of course it does. My husband never mentioned it. The doctor never asked. It was because I was there raising the issue that my husband liked to donate blood a lot, frequently. And because I am part of his life and his lifestyle, like that was the first thing that came to my mind when I walked into the doctor's office. And so sometimes, the people who know you the best, sometimes they're really helpful. So I'm glad you raised that issue because I do tell that story, when needed, but it worked for us. He's come to me with appointments and I've come with him to appointments, and you just like add and remember things. But, I think there has to be that synergy between the two people and that
For sure.
understanding. Right.
Yeah, for sure. Yeah, that makes a lot of sense, and I appreciate you sharing that story because I think that I think sometimes like if we're in the problem, we're in our body, we experience our body. Sometimes we may not be aware of certain things, and I think especially if it's something that sort of affects you, if it's a health issue or concern that affects you mentally, you may not be aware of that. You so yeah, so I appreciate you sharing that. So do you have like a website or social media or anything to share?
So my website is thethinkingpatient.com.
Okay.
And that is for businesses, companies, organizations that want to help upgrade the skills of their employees, of their patients. But people may find that useful. And then I communicate with people via LinkedIn because that's where I post the research that I do and some of the conclusions and strategies that I come to. I try to make it more like really functional, valuable information for people as I pursue and I keep pursuing, other ways to give people information to make them stronger and smarter. And that's why I call like my consulting company the Thinking Patient.
Hmm. Yeah, I like that. So, one thing that I ask everybody before we close, and this could be from your personal life if you're comfortable sharing it, or your career, what do you think is one of the most important lessons you've ever learned?
Yeah, don't be afraid of taking care of your health at an early age.
Hmm.
Right when you're feeling healthy and good, it's really important to take care of your health, and you need to be in charge, and you're the one in charge of it.
Yeah, I like that, man, because I think I mentioned earlier about sort of this longevity mindset, like thinking long term. And I think you said that, a lot of us, we don't think about health until there's an issue, you know. But I mean, but like you hear like now these days, there's a lot of different tests. Like there's like, I don't want to say gene mutations, but I think that's what it is. It's like methylation test and all that kind of stuff
Mhm,
that's going on. Gary Brecka talks a lot about it. Uh, he talks a lot about like what we experience as conditions are really like nutrients deficiencies
mhm,
because we can't really and I can't go into detail how he says it, but the way the food is in the world today, we can't really some of us can't process like the nutrients from the food that has to be methylated vitamins and stuff like that. So I think that awareness of knowing that, and there's different ways, I guess, to analyze your blood to get your blood tested.
mhm.
I think one Andrew Huberman talks about it a lot. I think it's I'll have to look up what his link is. But anyways, there's ways out there to get your blood tested for these different kind of things. But I think a lot of people that sort of they don't really know where to go for that. To like you said, a lot of people don't have, or at least they can't find a primary care doctor. So I think a lot of people just have an issue like taking that first step, like starting to go get the test or whatever it is.
Right, right.
So
And then there's the genetic testing too, which is, depending on some insurance coverage and other factors and whether you could afford it, getting or asking your doctor, I have this family history. I'd really like to get the complete panel of genetic testing, which is really only about like taking blood and sending it to a lab, and then the lab does all that work and gives a report back to a doctor. So that's important. And people do that more routinely now when they're having a baby, so that it's become more prevalent. But I do think that's something that people should consider when they're younger, 20s, 30s, that kind of thing, because it just helps you understand, uh, look, the more you face your fears and build your courage and do the things you need to do. What's interesting is that, I've had this very complex disease. I still take 15 different medications, but the biggest things I need to do are drink enough water,
mhm.
exercise, get enough sleep,
Yep.
be active, and socialize with friends. Those are the things that people say for my longevity and to keep me active and healthy. And what are these things? These are the things that we should be doing throughout our whole lives, right?
Yeah, yeah, for sure. Well, I appreciate your time and your insight here today, sharing this with us, and I do appreciate the wisdom you've provided. I think this is really important for a lot of people. I think, like I said, health is really foundational. So, and I think what you're doing here with this sort of framework, I think this sort of gets people in the space to ask the right questions and to find out these things and to move in that direction. So, I appreciate that. Um, if you can hang out for just a second, I'll explain to you how I upload this, but I think we're good on the uploads. But I'll explain it to you, and we'll go from there. But I do appreciate it.
Thank you so much, Cody.
Hey guys, I appreciate you tuning in today. If you enjoyed this episode, you can find more content at Pure Wisdom Podcast. This is on Facebook, Instagram, Rumble, TikTok, YouTube. Spotify, Amazon Music, and Apple and Google Podcasts. There you can like, share, subscribe, and we will see you next time.